Hi friends, this is Dr. Anugraha here. So today's topic is Kawasaki's disease. Tell me guys what you know about Kawasaki's disease. See, this is a vasculitis, okay? So what are the different kinds of vasculitis that you know? You know small vessel vasculitis, medium vessel vasculitis and large vessel vasculitis. Kawasaki's disease comes under medium vessel vasculitis. Alright, so this Kawasaki's disease is also called by the name mucocutaneous lymph node syndrome. What is it? Mucocutaneous lymph node syndrome. You will understand it better why it is called so. Because see, this basically blood vessels our blood vessels inflammation. Okay, mostly our coronary arteries inflamed down, and it can, if not treated properly, it can lead to MI. Okay, so yeah, just a brief introduction. There is going to be mucosal changes, like our lips, they're going to have cracked lips, strawberry tongue. They are going to have cutaneous changes. Our body, they're going to have rashes, polymorphous rashes and down, different forms of rashes and down. And there is going to be lymph node involvement, like our cervical lymph nodes, unilateral. See, very important, okay? There is going to be unilateral, means one side matram cervical lymph nodes is swollen. I'll show you the pictures. It was just an introduction. Once more, Kawasaki's disease is vasculitis, blood vessels inflammation. It is also called as mucocutaneous lymph node syndrome. You will understand why it is called so. And mucosal changes under our lips, I'll show you the pictures. They're going to have cracked lips. Okay, and something called as strawberry tongue, cutaneous changes under our skin and rashes and down, and lymph node involvement in down, or side lymph node, cervical lymph nodes enlarged. Okay, so this is an introduction. Fine, now see, why does this disease occur? The etiology is mostly, actually the etiology, the exact etiology unknown, but studies show that there could be a genetic predisposition, or some studies tell you that there is autoimmune response. Okay, our body is overactive immune response. Like our body, no, not our body, the patient's body will produce antibodies. And that the patient's body, okay, our overactive immune system antibodies are producing. These antibodies our body attack. See, our blood vessel, blood vessel, these blood vessels line chain cells, they are called as endothelial cells. Blood vessels line chain cells endothelial cells. So, these endothelial cells endothelial cells attack antibodies body thanna producing, because our body overactive, our immune system hyperactive. Okay, so etiology is, if your teacher asks why, you can say, ma'am, that is because of antibody production, anti-endothelial cell antibodies. These blood vessels line cheyna cells are endothelial cells. These endothelial cells kill attack antibodies are formed. Alright, now the complication is which kind of arteries are involved? Most commonly involved artery is coronary artery, right? The artery that supplies a heart. Coronary arteries these antibodies target. So the child can have what here? Coronary artery syndrome. And the child can, if the child is not properly treated, he can get what? MI. And yeah, there could be death. Okay, so there is a criteria. How will you diagnose a child to have Kawasaki's disease? This criteria is very important. See, the child usually occurs in children less than 5 years of age, and the criteria is the child should have fever. First point is the child should have fever lasting for more than 5 days actually, and 5 features, the 5 features that I have written here. These 5 features, at least 4. Okay, more than or equal to 4 features are kuttikundengil, then you can label the child to have what? Kawasaki's disease. You can label the child as having Kawasaki's disease. So the first feature is, dear, conjunctivitis. Okay, എന്താണ് conjunctivitis? Conjunctivitis means it is a inflammation of the conjunctiva. So ഇവിടെ ഒരു definition ഉണ്ട്, like how does this conjunctivitis look like? It is bilateral, both the, one second, yeah, just a moment. Okay, so conjunctivitis, ഇങ്ങനത്തെ കുട്ടികളിൽ conjunctivitis is going to be bilateral, very important, means രണ്ട് കണ്ണും ഇൻവോൾവ് ആയിരിക്കും. Okay, the child is going to have bilateral conjunctivitis. Second point is it is going to be non-purulent. Non-purulent അർത്ഥം എന്താ? See, അവിടുന്ന് കണ്ണിന്ന് പസ് ഒന്നും വരത്തില്ല. Alright, so it is going to be non-purulent bilateral conjunctivitis. First feature. Second feature, the child might have rashes. All right. Now, the rashes can appear. See, rashes where all can it appear? In the palm, soles. There could be peeling of the skin, okay, of the palm, soles. So that, and these rashes sometimes occur in the perianal region, periungual region. All right. So rashes done. Third is edema. The child can have edema of the hands, of the feet, okay, and there could be lymphadenopathy, that is swelling of the lymph nodes. So usually the lymph nodes are enlarged, cervical lymph nodes. Look here, see here, kanda. Okay, this is not a child's picture, but yeah, I just got it from net. This is cervical region, and there is what? Unilateral cervical lymphadenopathy. Very, very important. I'll tell you why you should remember this. There is unilateral cervical lymphadenopathy. നമ്മുടെ നെക്കിന്റെ ഏതെങ്കിലും ഒരു വശത്തായിരിക്കും ലിംഫ് നോഡ്സ് എൻലാർജ്ഡ് ആയിട്ട് ഇരിക്കുക അങ്ങനത്തെ കുട്ടികളിൽ. ഓക്കെ, ആൻഡ് ദർ ഇസ് മ്യൂക്കോസൽ ഇൻവോൾവ്മെന്റ്. മ്യൂക്കോസൽ ഇൻവോൾവ്മെന്റ് എന്ന് പറഞ്ഞാൽ മ്യൂക്കോസ, ദാറ്റ് ഇസ് the lips, the tongue will give a specific appearance, and that is called as, see, this tongue na, it looks like a fruit, it looks like strawberry. So there is strawberry tongue in such children. Very, very important. Strawberry tongue. Now, tell me, where can you see, tell me another disease where you can see strawberry tongue. Yeah, think about it. Let's go to the treatments. I told you this is an autoimmune condition, so you give IV immunoglobulins and you give what? Aspirin. Why aspirin? See, it has got anti-platelet effect. See, when I'm drawing a blood vessel here, okay. See, why in Kawasaki's disease there should be coronary artery syndrome? I told you coronary arteries are mostly affected in this disease. I've drawn a coronary artery, okay. And because of autoantibodies, the blood vessels, the coronary arteries can become inflamed. നമ്മുടെ coronary arteries ഈ കുട്ടികളിലെ ചില ഭാഗങ്ങളിൽ ഇൻഫ്ലെയിംഡ് ആയിട്ട് വരാം. സോ ആ ഇൻഫ്ലെയിംഡ് ആവുന്ന റീജിയൻ, ഓക്കെ, ലെറ്റ്സ് ഈ ഭാഗം വളരെ ഇൻഫ്ലെയിംഡ് ആയിട്ട് നിൽക്കുകയാണ്, ഓക്കെ, സ്വെൽ ചെയ്ത് നിൽക്കുകയാണ്. ആൻഡ് ഓവർ ടൈം ഈ ഇൻഫ്ലെയിംഡ് ആയി നിൽക്കുന്ന റീജിയൻ ഉണ്ടല്ലോ, അതിൻ്റെ തിക്നെസ് കുറയാം, ആൻഡ് ദർ കുഡ് ബി ബലൂണിങ് ഓഫ് ദറ്റ് റീജിയൻ, ഓക്കെ, ബലൂണിങ് ഓഫ് ദറ്റ് റീജിയൻ, ആൻഡ് ദാറ്റ് ഇസ് കോൾഡ് ആസ് aneurysm. Aneurysm എന്താണെന്ന് അറിയോ? That is ballooning of a part of the artery is called as aneurysm. Now, why should we worry about aneurysm? Aneurysm vanna what happens next? See, over time, I told you our artery thickness and korayum because there is inflammation and a part of the artery balloons. So, balloon pole oru bhagath ingane തടിച്ച് വരികയാണ്. ആൻഡ് സി വാട്ട് ഹാപ്പൻസ് ലേറ്റർ ഓൺ, സംടൈംസ് in the thickness, ഈ ഭാഗത്തിന്റെ തിക്നെസ് കുറഞ്ഞു വരികയാണ്. ആൻഡ് സംടൈം over time, this part, it can rupture. It can what? Rupture. So that is a serious complication. And see, another complication is, എവിടെ നമ്മുടെ ആർട്ടറീസിന് അല്ലെങ്കിൽ എവിടെ ഇൻഫ്ലമേഷൻ ഉണ്ടെങ്കിലും, whenever there is endothelial damage, platelets in our body will come. Okay? Platelets are the heroes. They will come to that region and they are like, okay, ഇവിടെ ബ്ലീഡിങ്ങിന് ചാൻസ് ഉണ്ട്, ലെറ്റ് മീ ജസ്റ്റ് സിറ്റ് ഹിയർ for a while. In case bleeding ഉണ്ടെങ്കിൽ I can clot this part so that there won't be much bleeding. അപ്പോൾ എന്ത് ചെയ്യും, ഇങ്ങനത്തെ കുട്ടികളിൽ ഇൻഫ്ലെയിംഡ് ആയിട്ടുള്ള റീജിയനിൽ കുറേ പ്ലേറ്റ്ലെറ്റ്സ് വന്നിരിക്കും. ഇതൊരു പ്രിക്കോഷണറി മെഷറാണ് ബോഡി ചെയ്യുന്നത്. എങ്ങാണ് അവിടെ ബ്ലീഡ് ചെയ്താൽ ക്ലോട്ട് ഫോർമേഷൻ വേണമല്ലോ, സോ ഒത്തിരി ബ്ലീഡ് ചെയ്യത്തില്ല. ബട്ട് കുറേ പ്ലേറ്റ്ലെറ്റ്സ് വന്നിങ്ങനെ ഇരിക്കുമ്പോൾ വാട്ട് ഹാപ്പൻസ്, ദർ ഇസ് ത്രോംബസ് ഫോർമേഷൻ, ക്ലോട്ട് ഫോർമേഷൻ, ദാറ്റ് ക്യാൻ ഇവൻച്വലി ബ്ലോക്ക് ദി ആർട്ടറി. അപ്പോൾ ഐ ടോൾഡ് യു മോസ്റ്റ്ലി ഏത് ആർട്ടറീസ് ആണ് ഇൻവോൾവ് ഇവിടെ? കൊറോണറി ആർട്ടറീസ്. സോ ഈ കൊറോണറി ആർട്ടറീസ് ബ്ലോക്ക് ആയ വാട്ട് ഹാപ്പൻസ്, ക്യാൻ ദി ഹാർട്ട് ഗെറ്റ് ഇനഫ് ബ്ലഡ് സപ്ലൈ? നോ. സോ ദ ചൈൽഡ് ക്യാൻ ലാൻഡ് അപ്പ് ഇൻ മയോകാർഡിയൽ ഇൻഫാക്ഷൻ. Understood? Okay. So we were talking about the treatment. You give IV immunoglobulins and aspirin. Aspirin adoru anti-platelet effect undu. Ee thrombus formation sammadikkathilla, and also it brings down the fever. All right. Okay. Differential diagnosis. Very, very important Viva question. What is the differential diagnosis of Kawasaki's disease? And the differential diagnosis is something called as scarlet fever. And that is scarlet fever. And we'll study in detail about this. Scarlet fever, see, it happens because of Streptococcus pyogenes. Okay, it's a bacterial infection. Again, the child will have strawberry tongue. Okay, and how you differentiate it is by two things. Ivar rashes in scarlet fever rashes it looks like it feels like a sandpaper. Sandpaper see, this is sandpaper. Okay, and when you touch it, or granular feel scarlet fever rashes. There is a sandpaper appearance mostly, they say appearance also, and when you touch it, it gives a sandpaper granular feeling. So that is a sandpaper appearance of the rashes in scarlet fever. And in scarlet fever, there is going to be bilateral cervical lymphadenopathy. Bilateral cervical. Neckinde rendu bhagatte sidesilum lymph nodes enlarged aayirikkum. Whereas in Kawasaki's, it was unilateral lymphadenopathy. Please don't forget it. Okay, scarlet fever bilateral cervical lymphadenopathy aanu. So that's how you differentiate. All right. Okay, then now let's do one question. A 5-year-old child presents with fever for 7 days, bilateral conjunctivitis, red cracked lips, swollen hands and feet, and polymorphous rush. What is your diagnosis? See, we are talking about Kawasaki's disease, so definitely the diagnosis is Kawasaki's disease, but not just that, okay? This child has got fever for more than 5 days. Okay, there is one criteria. Then bilateral conjunctivitis. All right. Then red cracked lips, mucosal involvement, swollen hands and feet, and polymorphous rush. So all these point towards what, dear? Kawasaki's disease. All right. So I think let's call it a day. I'll see you in the next class. Take care. Bye bye.